let's talk about rhinoplasty. So the main goal of rhinoplasty is to reduce the hump, to correct if there is any deviation, and to make the tip of the nose smaller and more attractive. However, these goals are different for each patient. Some patients may need a small reduction and some patients may need a huge reductions. In ethnic rhinoplasty, we may need to augment the nose as well, using cartilage grafts to augment the dorsum of the nose and to shape the tip of the nose. In rhinoplasty patients, we always evaluate the breathing as well. If there is any broken cartilage, we fix them. If there is any deviated part of the nose, like deviated cartilage or deviated bone, we also correct them. So if there is any need for these deviations to be corrected, then we perform a septorhinoplasty. I perform an open rhinoplasty technique using a very small incision here under the tip of the nose, which is barely visible, and I open up the bone, and then I use a preservation rhinoplasty technique in which I preserve the bony cap here and we reduce the bone in these parts and preserve the main cartilage and bone structures to shape the bone. I generally use silicone tampons and a cast after rhinoplasty surgery, and we keep the tampons for 3 days and the cast for 1 week. 1 day hospitalization is needed after a rhinoplasty surgery, and the patient can leave the country after a week. A classical septorhinoplasty surgery takes around 2 to 3 hours, depending on the patient's nose. And after the surgery, we advise the patient use ice compressions and not to use any glasses and sleep on the nose for a month.